So, as I often do, we'll get started with an overview of our COVID-19 numbers. Our data appear to have plateaued. So that's important to note. We were in a very sharp decline for several weeks. Our numbers are stable, but not decreasing as sharply as they were previously. Our percent positivity for over the last week has held steady at around 2%. Our number of new cases per week has essentially remained flat as well, but we did see a slight increase in the week-over-week numbers of our new hospital admissions. That number went from 118 to 135. The case rates in our cities and towns continue to trend down overall. However, we have seen some increases in some communities that we are paying very close attention to. Those communities include Cranston, Cumberland, Woonsocket, South Kingston, and Narragansett. We're continuing to watch those situations very closely because they also may be a sign of what we want to be prepared for and stay in front of in terms of what's possible with the whole state. We're also watching our COVID-19 variant situation very closely. It's important to really spend a few minutes on this so we understand that we're not fully out of the woods yet, but we do have a strong path. People just need to be aware of the importance for staying vigilant. We are seeing more and more cases of the B117 variant here in Rhode Island. This B117 variant is often called the UK variant. It is known to be much more contagious than the standard variant of COVID-19 that we have dealt with. And that's why it's important to pay close attention to it. Through our Dr. Eva King and our team at Rideau's State Health Laboratories, we are coordinating a sequencing surveillance program in partnership with the Centers for Disease Control and Prevention and our colleagues here in the state that are internationally known for their work related to these types of efforts. When we sequence a specimen, we are decoding the viral genome, the DNA of the virus, so to speak. And we're comparing the genetic code to the original strain of the virus to be able to understand when there is that difference. As I just described, and as you can imagine, this is a very complex process. So we don't do it on every single specimen, but we do it on randomly selected specimens to really help us understand what strains are circulating in the community and what proportion of our population is impacted by it so that we can continue to push that message of being vigilant. We don't want to get too comfortable yet until we are really fully moving forward in accomplishing the steps that we have in mind. So far, we have sequenced 653 Rhode Island samples. Of important note, in this most recent group of 85 specimens that were sequenced, 12 were the more contagious B117 variant. That's an example of how we need to be more mindful. We're very excited to be making a lot of progress on our vaccination campaign. That's what we balance our concerns with the variant up against, as well as the testing and treatment that we know is important. We all understand how critical it is for our business community and for all of us that we're able to make some of the restriction adjustments that the governor referenced, we talked about last week, and that is planned for activating tomorrow. However, right now, we estimate that less than 30% of Rhode Islanders are immune to COVID-19 at this point, either because they have been fully vaccinated or because they have had previous infection. Now, that is very quickly changing as we are administering vaccine at the very high accelerated rate that we are, but it's an important context for all of us to understand that there are still a lot of people who are out there who are susceptible. And it allows me to remind that we continue to have tools at our ready to help us to combat that. We've known that, and we want to continue forward. Mask wearing remains critical, even more so now than ever. It's the place that I keep bringing us back to because of how effective mask wearing is. We all have a little COVID fatigue right now. That's fully understood and appreciated. But the more we can encourage each other, remind our loved ones, protect our household, the better we can do, because we need to keep wearing our masks. It's still the rule in Rhode Island whenever you're with people who are outside of your household. Whenever you're with people you don't live with, please make sure that you are wearing your mask. And make sure that you're wearing a high-quality mask. That's even more effective now that we know that the variant is here and continuing to spread at a faster rate than the previous versions of coronavirus. Wear a high-quality mask and wear it correctly. Your mask should fit snugly but comfortably over your nose, mouth, and chin without any gaps. KN95, like the one I have, are very good masks to have, but you can also use a cloth mask that is at least 2 layers thick. For more information so that you can have what you need to protect yourself and protect your household, go to covid.ri.gov and click on COVID-19 prevention. On top of masking, which is one of our best tools, we know the 3 things that I always stress, which continue to be testing, treatment, and vaccinations. We continue to lead the nation in testing. The capacity is there. Please continue to take advantage of it. Get tested regularly. Get tested every week. Easter is coming up, among other days, as well as the spring. If you plan to see anyone from outside your household, get tested every week, and then get tested also on the days that lead up to the particular holiday or the particular event where you're going to get together with loved ones within that our social distancing guidelines. But use the resources that we have to stay safe. Our testing is fast, it's easy, and it's free. Go to portal.ri.gov to make an appointment for a same-day test. On the treatment front, I want to remind you again that we have treatment in Rhode Island. It is critical. It is very effective. It's keeping people out of the hospital. It's doing exactly what we need it to do, but we need you to access it, to know about it, to work with your provider or work with a provider, even if you don't have one. If you test positive, talk to a doctor about treatment, especially if you are older than 65 or you have an underlying health condition. Treatment is available whether you have coverage for it or not. It is there for you whether you have a doctor or not. We have doctors that can be available to get you connected to the treatment. It saves lives. We want to make sure everyone who qualifies accesses treatment. Go to covid.ri.gov/treatment or call our info line. Finally, on vaccination, we continue to vaccinate at a very strong pace. 136,513 people in Rhode Island are fully vaccinated. That means that for the first time, we can say that more people are fully vaccinated against COVID-19 than we have in Rhode Island that have been infected with COVID-19. I think we should all take a moment to reflect on how important that is. 12% of Rhode Island is fully vaccinated, which puts us at the national average, and we are in the top 5 nationally for first doses administered. That's on par with Connecticut, and that's a few slots ahead of Massachusetts. If you think about how effectively we have vaccinated both from our phase 1 strategy and into phase 2 within this relatively short period of time, so that we have more people fully vaccinated in Rhode Island than all of the months it took to have the number of people actually infected with COVID, it's encouragement for showing we are on the right path. As vaccines come in, here in Rhode Island, we're making sure that they are getting administered. A major project for us right now is building out our capacity, because we are getting forecasts about a lot more vaccine coming into Rhode Island over the coming weeks, as the governor shared. It's even over the last 24 plus hours that we've received some of those additional updates from our federal partners. And there's been a lot of talk about President Biden's charge to states to open eligibility to all adults by May 1st. And it's great that Tom is joining us, so that as the executive director focused on operations and really pushing our team forward, you can have the same confidence that we do as you hear some of those really logistical details that we have laid out on our ability in Rhode Island, given our infrastructure and capacity, to be able to surpass that May 1st goal. Based on the projections we're getting from the federal government and what we have already built out, we actually believe that we can open eligibility to the last age cohort on our timeline, which is people 16 to 39, by the week of April 19th, as the governor has shared. We'll be back with the specific dates of how we'll speed up those who are older, so that by April 19th, all those 16 plus will be eligible. To be clear, as the governor mentioned, we want to make known that not everyone will be able to get an appointment by April 19th, but we are prepared to make eligibility open for everyone, and so that appointments can start booking at that point for those 16 plus and be available for the subsequent 2 weeks or so, building out from there. But by that time, we will want to have vaccinated a large proportion of all those older than 40 years of age. So stay tuned with us on how we will help make that available. I wanted to reiterate what the governor has stated about April 19th, just to help people understand that we are getting close. And as you'll hear further details from Tom, to understand the confidence in the team and the tremendous work, even from earlier this week and over the last 24 hours to now, to be able to respond to what we're getting and move quickly to make vaccine available. We recognize that there is a lot of angst and frustration out there. We understand why. It's good in a sense that people are eager to get vaccinated. We want that to continue so that we can get vaccines into the arms of everyone who wants one and needs one. We are almost there. Our focus on having a great summer here in Rhode Island is right at our fingertips. In a matter of weeks, every Rhode Islander will be eligible to make an appointment for a first dose of COVID-19. As I stated last week, we are asking you, continue to hang in there. Be patient with us. It is just a little while longer, and we will make sure that we get there. We're ready, and we are able to get vaccines into the arms when the vaccine arrives here in Rhode Island. The last note I want to make on our vaccination campaign is that we have been working closely with municipal leadership, with our COVID-19 Equity Council, with our health equity zones, and many other partners over the last few weeks to move forward on the strategies to narrow the gaps we have and are seeing in our COVID-19 vaccination rates, particularly in those communities that have been harder hit. We have work to do, and we know that access and equity are major focus areas for us to advance on. We will get to that point. We won't give up in continuing to narrow the disparities that exist between those who are hospitalized and those who have access to vaccines. And with the governor's leadership, we will continue to advance our high-density community vaccination strategy to help close that gaps. I wanted to make clear to people that this is a priority for us, and we're putting it front and center and focusing on implementation in helping to make it happen.